down the mountain. And so to be able to do that on my own, with assistance, of course, but to have some ability to do that, to turn, to go downhill, to feel that breeze in your hair, you know.
Welcome to Parenting Special Needs Live. I'm Shantae. And does your child have physical limitations? You know, do you think that winter fun is not for your kiddo? Well, we're here to tell you that winter fun does not have to be held back from kids with physical limitations, you know, such as spina bifida or cerebral palsy. In fact, we found Dr. Nagarian, a child's doctor who encourages kids to push past their physical limitations. Dr. Nagarian is a pediatric physical medicine and rehabilitation physician at Akron Children's Hospital. And he was also once a kid with cerebral palsy. Dr. Nagarian knows firsthand that winter fun does not have to be on hold for kids with physical challenges. He's here today to share with us his story about how he started skiing himself and encouraging his patients to get on the winter slopes. So please welcome Dr. Nagarian. Hi, Dr. Nagarian, how are you?
Hi, I'm great. How are you, Shantae?
I'm great. Well, I want to hear a little bit about your story, like tell us about you, a little bit of your history, and then
Sure.
we'll
Sure. Well, as you mentioned, I have cerebral palsy, and so ever since I was a kid, had to figure out ways to be able to join in with friends, to play and have fun, and also with my family. I have 4 siblings, and we are a ski family for sure. So, and I'm 4 of 5 kids in my family. So, and most of my siblings are older, and they were skiers. And my parents, you know, never wanted to hold me back from anything that my siblings were doing. And so from a very young age, I would say about 3 years of age, my parents would put me in ski boots on skis and hold me between their legs going down the ski hills.
Wow.
And we did that for a long time until I got too tall and too heavy to do that. And so skiing took a little break from my life after that for a while, until I discovered the world of adaptive skiing that was out there.
Wow. So and how did you find it? I'm just curious.
Well, you know, we looked locally. I grew up in Southeast Michigan. And I think at some point probably talked to one of my therapists who said, you should go out west to Colorado. And there in Winter Park, Colorado is a wonderful organization called the National Sports Center for the Disabled. And they have a fantastic adaptive skiing program out there. So I started sit skiing when I was in my probably mid-20s. And so we would go out there every year and take a ski trip, and I would ski sitting down in the equipment that they have available for, you know, for people with physical limitations, physical disability. And because I was already a skier, I already knew the excitement and fun of going fast down the hill or down the mountain. And so to be able to do that on my own, with assistance, of course, but to have some ability to do that, to turn, to go downhill, to feel that breeze in your hair, you know, was wonderful. And so I continued to do that for a number of years afterwards.
And when did you start? Because now you also encourage your patients, right? I mean, so when did you start doing that?
Yes, well, I found out about the adaptive ski program locally here at 3 Trackers of Ohio when I was in training, in residency training, to be a physical medicine physician. But it wasn't until I had gone away to do my subspecialty training in pediatrics in Minnesota that I sort of saw, what I could do as a physician with patients to get them out there and participate and to play. When I was there, I saw my mentors. They had organized a ski day and brought probably 15 or 20 kids with them to, even if they've never skied before, novices and kids with experience as well, to spend a day, a half a day or a day skiing together and just having a lot of fun. And so when I came back to Ohio, I wanted to do something similar. And so knowing about 3-trackers, I contacted them and said, we should do something like this. And they thought it was a great idea. So probably for the last, 7 or 8 years, give or take a year for COVID, I try to take 5 or 6 patients from our center here out skiing together for a half a day at the local ski hill with 3-trackers, and it's always a blast. Everybody has a ton of fun, and I always try to get new skiers every year if I can, because I want to, spread the word about how fun winter skiing can be.
Yeah, I know. I think that's all awesome. So how do you is there certain requirements, like can anybody go, or like for skiing,
Right.
I should say?
Yeah, so they can accommodate kids and adults with a wide range of physical and intellectual disability. They have all kinds of equipment to suit what function a child may have, from different varieties of sit skiing and sit skis to upright skiing with assistive devices. And they have a set of wonderful volunteers who are trained and be able to work with people with disabilities to get kids up and down the hill safely and having a lot of fun. And so they just do a wonderful job. 3-trackers does,
Yeah,
which is why I continue to do this every year.
yeah, no, I think it's awesome. All right, so I want to ask a question. Maybe you can advise, because like you said, you wanted to go with your family skis,
Mhm.
and there was years when you couldn't because maybe you didn't know, or you weren't aware about adaptive ski at that time, right? But so if we want to try to help parents and families know more about it, is it something like where they go to a resort and ask, or do they find the adaptive place first? I mean, how does it work? Do you know?
Well, honestly, it probably depends on where you are. I think a good approach is to ask when you're there. A lot of places now, I mean, more than when I was a kid, have adaptive skiing programs. Some are smaller, some are larger, like the one I mentioned out in Colorado. And you can find out a lot of information online, and maybe that's the best place to start. Talk to your physicians, that take care of your child, especially if they're a physician like me, where we are sort of the doctors that focus on daily functioning and participation for our patients with disabilities, because we probably tend to have a little bit more of that knowledge than your general pediatrician. So there are different avenues. Support groups, if your child has a diagnosis where there may be a support group organized around that diagnosis or disability, there are probably parents and other people in that group that have some knowledge about where to go and how to seek out these opportunities.
So what have you seen in your patients? Like what are some of the, what do you see after they've done it, or during, or, what are some of the outcomes that you see positive or negative. I don't know if there is negative, but if there is, share that.
Well, I do think it's pretty much all positive, right? Because you get that experience of being able to do something that you've never done before, that's fun, that you can do with other kids, that have, maybe similar disabilities as you do. And so it's the enjoyment aspect, it's the sort of physical fitness aspect, right? This is, it is, can be put some physical demands, on you. It is exercise, and it's also that social aspect, of connecting with other kids, and I think sometimes I've seen kids, sort of develop some friendships, from doing this together. So from that standpoint, I think it's just fantastic, and we really should be encouraging kids to try these activities, get into adaptive play, adaptive sports, because all kids, that's what they want to do. They want to play and participate, and so we should be encouraging, our kids with disability and special needs, to get out there and do things as much as they can, just like their peers do.
Right. And I was going to ask, just something popped into my head when you were talking about, like, is there any, like, if a family was planning on going skiing and they were going to look into adaptive sports, are there any like little exercises that the kids should kind of, or is that something they should talk to the trainer? Is it something they should prep on a little bit to get their endurance up or something?
Well, not necessarily.
Okay.
I think that in my experience, these adaptive ski programs have worked with a wide range of children with different capabilities and different health statuses, and so they will tailor the experience to what that child is able to do. So you can go out there for an hour, and if that's all that you can do, that's great. And if you want to be out there for 4 hours, they're willing to take you up and down the mountain or the hill for 4 hours if that's what you can do. I do think it's important to talk to your doctor and make sure that there aren't any health conditions that would truly be a contraindication to being outdoors in the cold for a period of time. But other than things like that, I don't think there's necessarily any special preparation that kids have to have.
No, I'm excited. You just inspired me because I've been and took my older daughter that doesn't have any, disabilities. But I didn't, I guess I kind of like, protect my younger one that does have some physical limitations. And I'm thinking now you kind of inspired me like, hey, maybe we need to look into it because it is awesome. So
it's awesome. And I would encourage you, just as I would anyone with a child with disabilities, to see what's out there and don't be afraid to try something new. There are really great things out there for kids, and let's just all get out there and have a great time. That's sort of my attitude about it.
Yeah, I think that
Yeah.
would be awesome. So yeah, well, I can't thank you enough for what you're doing. That's awesome. I mean, keep doing it. And Kate, and thanks for sharing with us. Is there anything else that I didn't ask that you wanted to share about?
Well, I don't think so. But if anybody out there who has thought, well, I'm not sure about getting my child involved in an activity because of any potential downsides, or I think parents worry about injuries and things like that and getting kids into new activities. Just know that I think that the people that are out there that are providing these opportunities for adaptive sports and adaptive play, want the best for your child as you do, but also want to do it safely, and are going to do everything in their power to maintain that safety during these activities. So get out there and try as many different things as you can find with your child. Get the whole family involved, right? It's always better when, I think, when you can do these things together with family and friends. So let's do it.
Yeah, let's do it. I love that attitude. All right, well, listen, I can't thank you enough. Thank you everyone for joining us today. And in case no one has told you, you are doing a good job. It's hard work. Be good to you, and we'll talk to you soon. Bye.
Rafi Nagarian. Hi, I'm Dr. Rafi Nagarian, and I'm here today with a tip. Encourage your child with special needs and disabilities to get out there and try new things. I've been involved in adaptive sports for a long time, and there's a lot of opportunities out there. You may be worried about potential injury for your child in engaging in anything new where there may be contact or risk, but there's a wonderful world out there of adaptive activity and adaptive sports with volunteers who are waiting to help your child discover the joys of sports and activity. So don't be afraid, and find out where you can, where these opportunities are. Be an advocate for your child, as I know you do every day. Talk to your child's physicians. Get involved in support groups. Talk to other friends and family who may have children with special needs, and seek out these opportunities. There's nothing better for a child with disabilities to get out there and play and participate like their peers with typical development do. So I would just encourage you to get out there and do it, and don't be afraid. And there are people out there to help support you in seeking out these opportunities.
Well, thank you.